Good morning, good evening, everybody. My name is William of China United States Exchange Foundation, and I'll be your MC for today's event. Over the course of 10 months, CUSEF brings together 10 students from Beijing Foreign Studies University and Morgan State University who have collaborated and research on issues in relations to global health. We'll begin today's event with a welcoming speech by the Executive Director of China United States Exchange Foundation, Mr. Audie Wong.
Okay. Well, good morning and good evening. I'm very happy to see the joint research has come to this final presentation moment. Like many things in life, it seems that the COVID pandemic has brought to us both bad and good. More bad, of course, because so many people died or suffered. But for us on the bad side, it has prevented us from doing in-person exchange programs, something that we, the China-US Exchange Foundation, has been doing for many years, bringing more than 1,000 students from the United States and China together, working face-to-face. We have not been able to do that for nearly 3 years. But good things are often hidden in bad situations. The COVID pandemic has heightened our awareness that global public health is important to all of humankind. And it has spurred people across the world to work together in the hope of building defense for humanity. I anticipate that the presentations today will bring insights in these areas. I want to take the opportunity to thank all those who work together on this program. First, to the universities. CUSEF has been working with both the Morgan State University and the Beijing Foreign Studies University for many years. We are thankful that both schools have great trust in each other, a trust that is very precious these days. Secondly, I want to thank Professor Raymond Terry of Morgan State University and Professor Xie Tao of the Beijing Foreign Studies University, who provided guidance and supervision to the students all along. Facilitating a learning experience is the value CUSEF seeks in sponsoring these programs. Lastly, I want to thank our 10 excellent students whose hard work and dedication have brought us to the results we'll hear today. I trust you have not only learned from the studies that went into this, but also from working with one another and learning from one another. So let me wish today's presentation a great success. When the borders are reopened, which I hope will be soon, I look forward to seeing some of our American friends come to China on one of CUSEF's exchange programs. I'm sure you will find a personal visit the best learning opportunity of all. Thank you very much.
Thank you so much, Audie. And next, may we please invite the president of Morgan State University, Dr. David Wilson, for a keynote speech. Dr. Wilson.
Thank you very much, Mr. Long. Good morning and good evening to all of you as well. I am indeed honored to provide a few words on the occasion of the coming together of the students from the Beijing Foreign Studies University and the students from Morgan State University who have worked so well together over the last months, looking at issues of global health and how we have responded to the pandemic in which we currently find ourselves. I, of course, am very, very excited to see these two universities bring together the 10 students on the 5 topics that have occupied just a tremendous amount of their attention over the last several months. I certainly look forward to hearing some of the presentations because I know that we will learn a lot from them in terms of how both of our nations have responded to a crisis, which of course has not, in terms of the United States, we've seen in over 100 years. Of course, here in our country, we suffered a lot from the pandemic. In my own state of Maryland, we had a shutdown of the entire state. My university also closed, first time that we have been closed actually in over 100 years. And we really recognized some things during the pandemic, both as a university as well as a larger society. We first recognized disparities in health and how we must address those in order to ensure that everyone would have adequate access to appropriate medical and public health education and care. Also, we witnessed at record speed scientific and medical discoveries and advancements, which of course led to vaccines in record time that in a lot of ways prevented even more people from losing their lives. And so as president of Morgan State University, one of the largest historically Black universities in the country, I am always thrilled to see our students collaborate with students on the global stage. And of course, the collaboration with students in China is not new to us. Several years ago, we established our collaboration through CUSEF. We indeed were targeting students at HBCUs to go to China and to have experiences there, first 2-week experiences and then longer experiences if those students desire to have them. I am pleased to report that through that effort, I believe well over 1,200 students across HBCUs have actually had an experience in China. And that experience has been one to enable them to understand Chinese history, Chinese culture, Chinese art, just many aspects of the culture of the country in a very heightened way. Mr. Wang, like you, we certainly are hopeful that when the borders open again, that we can resume that particular collaboration and enable students to continue to come to China, and then vice versa, to open our universities for students in China who want to come and experience life in the United States at one of our historically Black colleges and universities. As I kind of bring my remarks to a close, I don't want to be too long. Let me just, for the sake of the students, give you about a minute or so overview of how higher education in the United States is organized, just briefly, so you understand the role that Morgan plays and the other 104 institutions like it. Higher education in the United States started with Harvard University in 1636. But from 1636, the founding of Harvard, to roughly in the mid 1850s, institutions in the United States at the higher ed level did not admit Black students. And so you had primarily religious organizations coming together initially to establish institutions that would come into existence to educate Black students. That is really the root of the founding of Morgan State University, and how at least about 65 or so of the 105 institutions came into existence, and then the other 40 or so were later as public institutions. And so these institutions today, they enroll over 300,000 students. Many of them lead the nation in terms of the production of Black students in various fields. And so we had Morgan at #1 in the United States, for example, in producing Black students in electrical engineering and also in other forms of engineering, in the health area as well, very, very strong nationally as well as in the state. And so we take very, very seriously here our role in providing student leaders in all kinds of spaces, in research spaces and in global spaces. Indeed, as one of the 5 goals of our strategic plan here at Morgan, one of them is to ensure that our students understand the world and that they can appreciate cultures all over the world. And we will be embracing more robust study abroad experiences for all of them. And so I want to once again thank CUSEF. I want to thank the 2 universities, and I want to thank overall the professors who have worked with these students, and to thank the students. And so I look forward to hearing some of the findings from your terrific presentations. Thank you very much.
Thank you so much, Dr. Wilson, for your presence and sharing. Now we can move on to the main sections of today's event. We'll now begin with the presentations of topic 1. So for those who are presenting, please keep your camera open. For those who are not, you're welcome to switch your camera off. All right, topic 2, I think, is Jing, Ya, and Darren. Sorry for what's going on, but you two can please go ahead with the topics of the blame game between China and the United States during COVID-19.
Okay, let me share my screen.
Yes, Jing, I think you're good. So you ready to go?
Oh, okay. Good evening and good morning, everyone. I'm Xiang Jingya, and Dalen is my partner. We have been collaborating and exchanging ideas throughout the project on the topic of the blame game between the United States and China during COVID-19. And many thanks to this opportunity provided by CUSEF and to immense support and guidance from Prof. Xie and Dr. Terry, and to this interesting and interactive joint research process. There is still so much to improve in our research. And we made a mind map to show the structure of our paper. It is divided into these 4 parts: introduction, attitude change, discourse, characteristics, and consensus building. So basically we chose this topic because blame shifting narratives in the international discourse were particularly evident and intense, especially at the beginning of the outbreak. For instance, I believe many of us are impressed by these expressions like US own us in explanation, or the expression of Chinese virus, Wuhan virus, etc. So competing narratives like these appeared so frequently, as if a blame game is played between the 2 countries. So we collected the views of the officials to understand how the so-called blame game and tug of war were play out in political communications, and tried to figure out the characteristics and logic behind. After introducing the research backgrounds, research questions, and research method, in the second chapter, we divided the COVID-related statements of the United States and of China into 4 different periods to see separately the attitude change. And in the third part, we analyzed the discourse characteristics, including the rhetoric of different stages, the main topics, and worldwide negative consequences. Initially, the statements were dominated by objective messages about epidemic prevention measures and some international medical aid, but later more tit-for-tat narratives emerged under the influence of domestic politics like the election or some international opinion pressure. If we look at the timeline, we will see this attitude change more clearly. The officials play out the tug of war mainly around whom to blame and who was better at controlling the epidemic, with neutral accusations of inadequate public health responses, misinformation, and conspiracy theories. Analysis proved that the blame game actually was not motivated by hostile political attitudes or ideological confrontation, but rather by the need to deflect domestic political pressure and externalize responsibility by shifting the blame amid a crisis, or we can say amid an emergency. And to some extent, the public discourse of the officials had a potential audience, domestic audiences and international audiences, and had specific political purposes that ultimately weaponized and politicized global governance issues. And when diplomats and other vital officials proactively sent messages to the public and amplified some conspiracy theories, they were like some key opinion leaders and super spreaders, and played a role in setting the agenda and changing public perception in the information war. And consequently, apart from the virus, the blaming narratives also became contagious, leading to the distraction of public attention and worldwide negative consequence. And besides the competing narratives, it is also important to mention some more profound barriers to consensus building. And my excellent partner, Dalen, will introduce our fourth part.
Absolutely. Good morning, everyone. Our fourth part, which leads into our conclusion, we talk about the consensus building difficulties and perspectives for the future. Here we have a table that we actually include in our paper that we reference, just outlining many of the previous opportunities in which China and the United States have collaborated along public health. We reference quite a few different areas, just to outline the opportunities and potential future for collaboration. Although the experience for collaboration and competition has been really highlighted and really heavy in the past, there is a bright future, not only for China and the United States, but for us to collaborate along with other countries to basically create a brighter path for solving not only COVID-19, but other public health crises. I'll pass it to Olivia.
Okay, that's the structure and brief introduction of our presentation. Thank you all.
Well, thank you so much for your sharing. Next, we will move on to topic 3, Chinese and US medical assistant to ECOWAS, the case of Benin, by Menghan and Brittany.
Good morning and also good evening, dear teachers and students. The topic of our group is Chinese and US medical assistance to ECOWAS, the case of Benin, and Brittany is my partner. For our paper, we have first made a comparison study of Chinese and US medical assistance to ECOWAS. And then when focusing on the case of Benin, we made a case study to analyze Chinese and US medical cooperation to ECOWAS. And I will mostly talk about the first part, and then for the second part, we will move to Brittany to introduce it to you guys. So to begin with, we have outlined Chinese and US medical systems respectively. China gave emphasis on ameliorating the medical and public environment in the local. China had a long history of medical assistance to Africa. As early as 1963, China dispatched its first medical team, which along with infrastructure construction, accounted for the most important part of foreign aid. The diverse type of medical teams, for example, the long-term medical team, the short-term medical teams, and also the special medical teams, and also the paired-up working mechanism, which we can see from the figure on the left, improved adaptive capacity and also the efficiency of medical teams. However, given that China International Development Cooperation Agency was established to strategize the internal management, concrete reforms had not yet been materialized to convert the imaginary way to real. And then we come to US. US medical assistance to ECOWAS can trade back to 1944, and it was based on long-lasting programs, which are systematically supervised by US aid. By means of funding and material support, training of medical workers, etc., the United States was involved in local medical governing and attempt to reform the medical systems and policies in ECOWAS states. Subsequently, we analyze and compare the mechanism and also the type of foreign medical assistance of the two countries in detail. We find that although the structure integrity was different in China and in the United States, the purpose and the method of foreign assistance was rather clear. China employed an environment to environment and then to politics path, committing to infrastructure construction in the ECOWAS states to enhance the availability of medical facilities and portray China as a good and responsible major country. The United States employed a policy to environment and then to politics path, committing to policies and systems construction in the targeted countries, as they have shown its pride and moral superiority, and believed in the universality of the values and the governance. Since China and US have implemented the method and provide medical assistance to ECOWAS for years, the result is actually not that good. Thus, we have made a case study of Benin. So let's invite my partner to introduce it.
As many countries in West Africa, Benin has a very young population with an average life expectancy of 61.8 years and a high incidence of disease. The health system of Benin has been weakened already by the endemic diseases of malaria and Ebola. And historically, Benin has looked for ways to extend their health coverage and receive assistance from major countries such as China and the United States. The goal of its health system is to maximize its current resources and to create strategic partnerships with major countries that can provide aid, and also increase its political instability. Unfortunately, like many countries in this area of the world, there is a high level of political instability, and international watchers have been watching the political makeup of the country, and it is on the verge of totalitarianism. So that can also play a role in the stability of their health system. It's been estimated that 1% of the population in Benin has HIV. And also there are, at the end of 2021, there have been 161 deaths due to COVID-19. This has been very low as compared to other countries. However, as stated previously, the health system in Benin is very weak. And so in order to prevent any further morbidity and mortality due to COVID-19, creating strategic partnerships with China and the United States is key in terms of ensuring that this pandemic doesn't grow into a more severe situation. The United States was involved in medical assistance in Africa much earlier than China. The first partnership was in Liberia in 1944. The goal of the United States assistance to Benin is more focused on developing a democratic society. The USAID manages the aid portfolio of the United States, and the goal is to basically help Benin to grow into a more democratic and egalitarian society. In comparison to China, China more so works in tandem with the country in terms of trying to be a partner in its in the country's goals, not so much in building its democratic capacity, but more so having a more pairwise approach that we'll go more into. Another challenge is only 4.6% of Benin's GDP is allocated for healthcare, which is 154th in a global scale. As you see, this is a major challenge in terms of having access to proper healthcare for its people. The US government is focused on medical cooperation and disseminating supplies to community health workers, which are a major resource in the country. There's a very low number of medical professionals, such as doctors, nurses, and other medical professionals in Benin. Some community health workers are very key in disseminating care in rural villages and remote areas of the country. This is the end of our presentation. Thank you so much for your time and your attention.
Thank you so much. Next, we'll have the group of analyzing the performance of the World Health Organization during the COVID-19 pandemic by Ming Xuan and Orolua.
Good morning, good evening, everyone. My name is Orolua Fashola, and my partner, Mijuan, and I will be presenting on the multilateral cooperation in public health during COVID-19, analyzing the performance of the World Health Organization. Next slide, please. So the World Health Organization was created on the 7th of April, 1948, and since then has been involved in various disease prevention and control campaigns, such as eradicating polio and smallpox, as well as other disease campaigns against syphilis, yells, and many other diseases. And then the World Health Organization is also involved in global health governance and is also one of the major organizations involved in pushing the global health agenda and also establishing the legally binding treaties such as the international health regulations. So the World Health Organization has faced many challenges during the COVID-19 pandemic, which will be discussed later in this presentation by Juan. And we believe that the way the World Health Organization has been able to overcome these constraints is something that is worth studying. And so our research questions are, what type of constraints are confronted by the WHO? How did the WHO overcome these constraints during the process, and how to evaluate the performance of the World Health Organization against the backdrop of constraints? So I'll hand over to my partner, Vijuan.
Okay, thank you. Okay, good evening and good morning, everyone. Based on literature, researchers have identified what types of constraints that the WHO confronted during public health emergencies, such as financial, cultural, political, design constraints, and so on. As for the constraints that the WHO faces during the COVID-19, we categorized them as political constraints, enforcement constraints, and resource constraints. So first, political constraints refer to the weaponization of the WHO by the United States. The former US President Donald Trump accused the WHO of being the puppet of China or covering up for China without substantial evidence. And the stigmatization of the COVID-19 virus exacerbated the conflicts between the US and China. Besides, the US joined 13 countries of questioning the WHO report on coronavirus origin tracing, handling a health issue as a political issue, which disrupted the WHO's work. And second, the WHO is an international organization with no sovereignty, no monitoring or enforcement tools. Member states were unwilling to fulfill their obligations specified in the international health regulation, such as reporting epidemiological data to the WHO in time. And this is pointed out by the WHO Director General and other international organizations. And some countries were reluctant to cooperate with the WHO or join the WHO-led initiatives and projects. And some countries didn't follow scientific guidance of the WHO. Third, the financial problem that have already existed for a long time is still plaguing the WHO. During the COVID-19, the problem was amplified. The exit of the United States in 2020 put a strain on the WHO's finance, and there is shortage of thematic and strategic engagement funds, for example, the Access to COVID-19 Tools Accelerator. And next part, we believe it is necessary to study and highlight how the WHO coped with severe challenges. So first, the WHO manages to depoliticize the COVID-19 pandemic, reduce the stigmatization by countering place naming. The WHO issues statements to underscore its impartial position and its role as an international organization, and the leadership played an important role. The Director General gave a number of speeches in press conferences warning against politicization. And second, to overcome enforcement constraints, the WHO kept improving the efficiency of data collection and analysis and conducting scientific cooperation with friendly member countries and research institutions, leveraging multilateral dialogue mechanisms and disseminate scientific and accurate knowledge about COVID-19 through multiple channels, including social media. Third, the financial resources from multilateral organizations and regional cooperation organizations are increasing. From this chart, we can see that the European Commission, the World Bank, the Gavi Alliance, and UNDP are among the top 15 contributors to the WHO for COVID. And the Sustainable Financing Working Group was established as part of the ongoing financial reform of the WHO. And this is a summary of constraints and how the WHO overcomes them. Our conclusions are to evaluate the performance of the WHO. We agree that it has imperfections, but taking the constraints into consideration, it is fair to say that the WHO responded to the COVID-19 in an all-around timely and scientific manner. And it has made progress. The pandemic is still not over. Ending the pandemic is not the sole responsibility of the WHO. To improve requires joint efforts of member states. And thank you very much, and we look forward to your comments and suggestions. Thank you.
Thank you so much. And next we'll have a comparative study of Chinese American public health aid during the COVID-19 pandemic by Hai Xiao and Christina.
Hi everyone, can you see the screen?
Perfect.
Okay. Hi everyone, my partner Tsunami and I worked on a comparative analysis of international public health aid offered by China in the United States. As a part of our introduction, we broke our research background into 2 points. First, the origin of COVID-19, in which we found out as of June 29th, 2022, there have been over 500 million confirmed cases and 6 million confirmed deaths across the globe. We also explored the similarities and differences between how China and the United States handled similar public health crises. Both China and the United States engaged in giving public health aid. Scholars and professionals have pointed out that both have advantages and pitfalls. So we had 3 research questions in our report. First, how did China and the United States provide public health aid during COVID-19? Second, what are the similarities and differences, between Chinese and American public health aid? And then third, what causes these similarities and differences? So what did public health aid look like during COVID-19? In terms of the aid offered by China, medical materials and vaccines were 2 types of aid China preferred to give. There were 2 stages of Chinese public health aid. During the first stage in 2022, the main form of aid given was medical materials. During the second phase, the main form of aid was vaccines. During the initial stage, certain industrialized countries got medical supplies from China. However, during the second stage, more countries were open to Chinese immunizations. Aid was heavily weighted in favor of underdeveloped nations. China appeared to dislike financial aid. The only direct aid donations that were given were to the World Health Organization. However, China tended to favor providing direct assistance to its citizens over using organizations as a middleman to hand out resources. The American public health aid is broken down by administration. During the pandemic, when it first started, it was under the Trump administration. This administration did more harm than good. For one, Trump severed ties with the World Health Organization, and he made racialized comments, against China and the COVID-19 discovery place by calling it Kung Flu and Wuhan virus rather than referring to COVID-19 by its correct name. As well, during the beginning of the pandemic, in the early stages of the vaccine rollout, the Trump administration made deals with Moderna that was beneficial to Moderna in the United States, but it did not take other countries into consideration. On the other side, there's the Biden administration who had to rebuild severed ties. President Biden was on the opposite side of the spectrum, both nationally and internationally. In fact, he pledged that the United States would donate over 1.2 billion vaccines to complete the global requirement as a part of the international immunization campaign. In fact, he developed different components of his COVID-19 pandemic strategy for halting the virus spread abroad.
So in our report, the next section of our report is about the similarities and differences between the 2 countries' public health aid. And in our report, we compare them from 4 aspects. In terms of rate transparency, we found that both United States and China disclose their aid information on the official website. However, most information that China disclosed are scattered, while the United States did a better job to gather the data and then present them in a more organized way. And when it comes to guideline on public health aid, we found that the global community of health for all become a guideline for China, China's COVID-19 aid since 2020, while President Trump fails to propose any national plan to guide American aid until the Biden administration released the US COVID-19 Global Response and Recovery Framework. And we also found that both China and the United States hopes to improve their national image through public health aid. China hopes to reverse the blame that it spread the virus deliberately, while the United States wants to restore its role in leading the world through global crises. And vaccines are important to contain the COVID-19 pandemic. We found that both China and the United States donated a large number of vaccines to similar areas. However, China preferred to donate through bilateral cooperation, while the United States usually cooperated with multilateral institutions. And since we have found these similarities and differences, our next step is to find the reasons behind them. And in this paper, we propose 3 reasons. The responsibility to defend public health can explain why the recipient countries of Chinese and American aid were almost similar. The medical level of countries in these areas was rather low. It is difficult for them to deal with the pandemic independently. So the humanitarian responsibility urged China and the United States to distribute aid to these countries that was most in need. And public health aid also serve political aims to improve the country's national image and enhance its political influence. Many scholars point out that Chinese aid is effective for it to improve its national image. And some American scholars also urge that the United States, the US government should maintain its international influence through providing similar aid. And we also found that the United States possesses rich experience and achievements in terms of public health aid. It has established a relatively mature aid system and fostered close relationships with other countries and organizations. Well, as an emerging international development partner in the health field, China still lags behind the United States in terms of multilateral cooperation, aid transparency, and so on. So through our study, we found that aid from the United States and China is important to save people's lives and contain the pandemic. And the COVID-19 pandemic reveals that in the era of globalization, the health of people all over the world is closely connected. And we suggest that all countries should work together to handle potential public health crises in the future. And we sincerely hope that China and the United States can cooperate together for the health of people all over the world. So this is the end of our presentation. Thanks for your listening.
Thank you so much. Last but not least, we will have, during COVID-19, comparative analysis of local public health emergency management in the United States and China, presented to you by Yu Ting and Maria.
Good morning again.
Perfect. Now you sound really well.
Thank you so much. And thank you guys for your patience. And again, we'll be covering the COVID-19 and comparative analysis of local public health management in the United States and China. And the content of our presentation includes concept definition, outline of the research paper, comparative study findings, and the conclusion. I'll be going over the concept definitions and also the outline of the research paper, and Yuting will be going over the comparative study findings, and then I'll come back and do the conclusion. In part 1, our concept definition, local public health agencies. Local public health agencies refer to city, county, district, and town levels of government agencies whose primary work are to protect and improve the public's health. Local public health agencies include public health departments and public health agencies. There are 2 reasons why we chose local public health agencies as our research subject. First, we were the first defense in the epidemic prevention and control system. And second, we play the key role in responding to public health emergencies. In part 2, for our project, we looked at our project and we broke it down into 4 sections. Comparative analysis of local public health emergency systems in the United States. And the first section is in section 1, we looked at public health emergency management in the US and China. And in that section, we looked at organizational structure, duties and authorities of local public health agencies. in the management of the two countries. And then in section 2, we looked at the resources to COVID-19, the similarities and differences of local public health in the two countries. And in that section, we looked at the mitigation strategies planning. We also addressed the resources crisis and the implementing of the epidemic prevention and control measures. In section 3, we looked at the difficulties and improvement measures. First, we looked at the difficulties, and we looked at, in that section, the insufficient resources, coordination and communication problems. And then we looked at attitude problems, which involved disregarding epidemics prevention and control. We also looked at measures to improve the management system. And in that section, we looked at litigation, policy issuance, and new coordination agencies. And now we'll switch over to Yu Ting, who will now do part 3 and all of part 3, which will include a comparative studies finding. Yu Ting?
Okay. Yes, I can hear you. Can everybody hear me? Okay. In this part, our research paper first introduces the structure of public health emergency management in China and the United States, then compares the duties and authorities of local public health agencies in their respective management system. Both China and America has a three-tiered public health emergency management, but the structure is quite different. Public health emergency management system in China is a top-down leadership mechanism with few direct interaction between the central public health agencies and local ones. The paper, while public health emergency management in the United States features with a multi-center leadership mechanism, over 50% of local health departments are not governed by state health departments. They are independently operated by local governments or just by the health districts themselves. The paper argues that public health emergency management define duties and authorities of local public health agencies in the two countries. Although local public health agencies in the two countries provide 10 essential public health services, American local health departments have greater authorities compared with the Chinese local health departments. Different authorities and organizational structure influence the behavior, or what we will introduce in the next part, the response to the COVID-19 pandemic. The paper chose local public health agencies in the Snohomish County, a county in the Washington state, and Wuhan Municipal, a city of Hubei province, as research cases for better comparison. Although the two places vary in population density, GDP, and geographic conditions, they are the first places in the United States and China where the COVID-19 outbreak started. They can provide a quite complete timeline recording the response to the pandemic. The paper concludes the response to COVID-19 pandemic by local public health agencies in the two countries and divides them into three main behavior: mitigation strategy planning, addressing the resources crisis, and implementing the epidemics prevention and control measures. The table shows that both American and Chinese local public health agencies took similar actions related in this three main behavior, but there are also a few differences drawn from the responses. In mitigation strategy planning, local public health agencies in America have greater power in decision-making. For example, the Snohomish Health District choose to follow the instruction and guidance from the CDC and formulate their own strategy. Wuhan Municipal Health Commission developed specific regulations, or we say detailing the national's response strategy for better implementation. In addressing the resource crisis, American local public health agencies tend to supplement resources through standing established cooperation mechanism, while local public health agencies in China rely on the short-term mechanism built for overcoming the temporary crisis. when implementing the epidemic prevention and control measures, because the United States and China deployed different policies. Two countries took different stringency of epidemics prevention and control measures. However, local public health agencies in the two countries face similar difficulties and expose problems in their fight against the COVID-19 pandemic. The problem of insufficient financial resource support, medical staff, health workers, and medical supplies has been warned by the academics long before the pandemic. But our government and the public health agencies some kind of neglecting the importance of the epidemics prevention and public health emergency management. And there are also the communication and coordination problem. The coordination problem in China are because that the local public health agencies in China are used to receiving directives from the higher authority. They lack of self-driven risk communication with other agencies to increase horizontal coordination. In the United States, the federal government should have been the central coordinator in the public health emergency management, but we can see that the Trump administration did not perform very well in the vertical coordination. Luckily, two countries have realized that it's time to reform the public health emergency management. Both state leaders addressed the importance of the reform, and two countries also released a series of acts, regulations, and policies, as well as set up new coordination agencies or position. And that's the end of my report. My partner, Ms. Anne-Marie Core, will give the conclusion part.
And in conclusion, the paper studies the response of local public health agencies and explore the breakdown of the public health management through looking at different difficulties of public health agencies due to their role as the cornerstone of the health system and the first defense of the pandemic. China and the United States are learning from the mistakes and are determined to rectify them. However, the reform measures proposed and implemented have not covered all the problems revealed in the research. The COVID-19 pandemic may come to an end, but new epidemics such as the monkeypox began to spread. We are seeing that there are a lot more issues that we need to look at that could lead to pandemics of this nature. Therefore, public health emergency managements will be tested once again and will be vulnerable if it doesn't make any progress in the reform. That is the end of our presentation. We thank you so much for listening. And again, we apologize for what happened in the beginning. Thank you so much.
Thank you so much. And I think you're all good. The presentation was really well done. And now may we please invite Professor Sear to give us sharing remarks. Professor Sear, you might have the floor.
Okay, so good morning, people in the United States, and good evening here for the students and people in Hong Kong. First, I want to thank President Wilson for giving this your presence and your speech, encouraging the students, and I very much appreciate that. And also, I want to really thank Dr. Terry and also the folks in Hong Kong, CUSEF, because of your financial support and your logistic support, that this program would not have been possible without all your dedication and support. This is a wonderful team, and so I very much appreciate that. And I also want to congratulate all the 10 students for your hard work. And I know it's been a long year. I just checked with Wen Chen, our coordinator on the Chinese side, and she said it's exactly 1 year, starting from the beginning when we began to recruit students from BFSU. But time flies, doesn't it? And so now you look back and you see, wow, we have, just had a long journey, but eventually we're coming to the end of the journey. So again, congratulations to all of you. I learned that this is a very rewarding process, to say the least, but also it's a process where you test your patience, you test your interpersonal skills, you test your intercultural communication skills, because you are separated not just by the vast Pacific Ocean, but you are also separated by many, many different cultural norms, expectations, habits, and ways of writing and speaking, right? And so I think, like I just wrote down here, even though the COVID-19 divides the political leadership in Washington and Beijing, but it fortunately unites scholars and the people like you guys. We are united because of COVID-19 to try to tackle some of these most challenging issues that we're facing as a human community. Like you look at the 5 topics, number 1 is about the blame game between Washington and Beijing. And the second, Menghan and Brittany, they examined US and Chinese medical assistance to ECOWAS, and they also used Benin as an example. And then you look at, Menghan and Orilua's examination of the WHO's performance. And then you have US-China comparative study of the 2 countries' public health aid assistance during COVID-19. And then last but not least, Yu Ting and Anne-Maria Kaur had a case study of the Chinese and American local public health organizations. So these are wonderful topics, and you guys have done a terrific job in addressing these issues. And of course, there are still some weaknesses to be improved upon. For example, how do you highlight your major findings during your presentation? How do you make your written English better? And then how do you organize your paper in a more logic and a coherent way? So blah, 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 they are always, but we all used to be students. Like I look back at the days that when I was a graduate student, I also learned so much every time when I talked to my professor, my supervisor, right? I'm sure you guys also had the same feeling. After each time you talked with your mentor, Dr. Terry, or you talk with your team partner from the other side of the Pacific Ocean. So again, I want to congratulate all, and I want to thank Dr. Terry for bearing with me and all the Chinese students. And also especially I want to thank CUSEF staff for your financial and spiritual support. And I do hope that we would have more programs like this in the future time. I'm pretty sure the COVID-19 will be gone, but the spirit of cooperation and this kind of cross-cultural empathy will last, will outlive the COVID-19, and will continue to guide our future younger generation people like you guys. Okay, good evening and good morning again. Back to you, William. Yeah.
Thank you so much, Professor Sear, and I'm sure all the students that have learned and benefited from your sharing and from your help a lot. Next, may we please invite Dr. Terry from Morgan State to also share a little bit on his remarks on the project. Dr. Terry?
What I could say is spectacular. This was fantastic. Each of the students came to the table with certain skills, but I can assure you that each of them have also gained and acquired other skills as a result of doing this comparative type of analysis between the 2 nation states. One of the things that's very key is that they had enthusiasm. I thoroughly enjoyed working with them. I ditto everything that Dr. Cole just said. The most important part about this is how you have gained new skills, acquired new skills. This is for the students because this is about them, in reference to what you can do in the future as leaders in relationship to looking at public health issues or systemic issues in 2 different countries and compare them, and then also to be able to decide what you want to do professionally in your lives. One of the things I think is key is that each of the students have learned how to do comparative analysis, how to deal with team building. But most of all, I think it's very important to stress the fact that one of the things the experiences really sort of emphasize okay, is how we must look at policy differences and how we must look at differences in approaches. This is one of the experiences. Well, not only did you do research on post onset of COVID, but you actually lived through a process while we were doing the research of lockdowns, spreading. You looked at it from a multilateral perspective. This is fantastic skills you have gained so that I can very well say that we now have 10 new comparative research analysts globally between the 5 students from the United States and the 5 students from China. You have mastered the skills of how to do comparative analysis, how to deal with descriptive analysis, and also basically you've gained a skill set that many students do not have an opportunity to do. And that's how do you do comparative research from a team research perspective. Much of what you're doing, this is a life journey for you guys. It is extremely important that you always remember that your knowledge, your skills, your abilities to set policies, guidelines, will enhance the lives of other people. And that's the key point. What do we do during our life journey to enhance the lives of other people globally and enhance how humanity, from a humanitarian perspective, we are able to work locally and then have an impact globally. Thank you, guys. All I can say is kudos, bless you, and always work in a state of peace and tranquility, and which then brings harmony and cooperation. Thank you so very much.
Thank you so much, Dr. Terry, for your very kind and insightful sharing. And the project has no doubt shows that a positive collaboration is most often needed and helpful in times of difficulty. And I hope that this is the beginning of many more collaborations between the United States and China in the future. So at CUSEF, in order to acknowledge that, in order to acknowledge the input and all the hard work that the students have put into the project, we have prepared a certificate for all students. So in here we have Yuting. And can we please have our students and Maria? We also have Jinya. Here we have Dylan. We have Menghan. We have Brittany. We have Mingxian. We have Oyolua. We have Haixiao Tsunami. We have also Christina, and the certificate will be sent to you in due course. And I thank you for your attendance tonight, ladies and gentlemen. The research paper, they will be published on our website, and all of you are really welcome to check them out. And that's all, and have a great rest of your day and evening. And thank you so much again for your attendance here.